The National Education Association recently stated, despite the momentous efforts of educators during the pandemic, online learning has never been an effective replacement for in-person learning. We know school closures harm low-income students the most because they have less access to high-quality remote learning.
President Trump making the case to reopen schools, stressing the importance of in-person learning and the economic benefits of schools and childcare. U.S. Secretary of Education Betsy DeVos joins us now. And Secretary DeVos, thank you for joining us. We very much appreciate it. It seems to me, and I want to put these Gallup polls up on the screen, it seems to me and to a lot of Americans that this push to get in-person learning is losing a little bit of steam. You see there from May 25th to June 8th, 56% of the population said they wanted in-person full-time school, and you move forward to July and now it's down to 36%. So the whole push seems to be losing steam. What does the administration think about that?
Well, we know that it's a coordinated effort in a campaign to continue to sow fear. And yet, when you look at facts and when you look at the science, we know that the important thing for kids is to be able to get back into school, into their classrooms, back with their peers, back with their teachers, and learning in person. And for most students, this is the case. There are some for whom it's not the right answer, but we need kids back in school learning. As Secretary Azar has rightfully said, this is a matter of health versus health. Children's mental growth and well-being, their social-emotional growth, their development, all of it relates to a continued effort to make sure students have the opportunity to be back in school full-time.
You talk about following the science, and you mentioned Secretary Azar, and, back in June, the CDC was saying that, the risk to children appears to be very low. Well, we've had a little bit of a change since then, because now you have the American Academy of Pediatrics and the Children's Hospital Association. If I can put this on the screen, between July 9th and August 6th, there were 179,000+ cases of children getting the coronavirus. That's an increase of 90% over 4 weeks. Does that number give you pause at all, Secretary?
Well, we know that children are going to get the virus, adults are going to get the virus, but the facts have been that the virus has not impacted children in the same way that even the average flu season does. The number of children that have actually succumbed to the virus versus the flu is like 1/6 the amount of an annual rate. And so, again, the focus really needs to be on doing the right things. The CDC has provided a lot of guidance and a lot of recommendations. Many schools have reopened, and they're doing so successfully when they follow this guidance and they take the matters seriously. But the point is, they're doing the things, some of them hard, some of them unusual for a normal school circumstance, but they're doing the things that need to be done to get kids back into the classroom and back into their learning.
Yeah, the president floating this idea, Secretary DeVos, of having the money follow the children, and the schools that open giving them some money, and the schools that don't pulling back some money and giving it to the kids. The pushback has been pretty severe from Democrats and educators across the country. Your thoughts on that?
Well, we make a promise when we invest in education, and that is to actually educate children. And that promise is made to their families. And if that is not going to happen, the president's absolutely right. Parents should have the power to take those resources and find a school or an environment that's going to work for them. We're seeing a lot of schools, a lot of charter schools, a lot of private schools that are successfully reopening. And we need to ensure that parents and children have these options as well.
Yeah, it's interesting because, you see a lot of these patchwork plans around the country. And I lastly just want to put this up there because Georgia schools seem to be a lot of focus. There's a lot of conversation about what's happening there. They opened 59 confirmed cases. They've got more than 1,000 students quarantined. This appears to be what might happen. You understand the risk, and you believe that everybody is still on board in the administration with going forward and saying, you know what, we're going to have some setbacks, but in the end, there are kids that need student meals, they need internet, they need supervision, and they need to get back in school.
they need to get back in school. And again, the CDC has provided very good information, very good recommendations and guidance, and have laid out procedures for recommendations for what to do when you do have a case or a couple of cases in a school. And if those things are followed and they're taken seriously, a lot of this can be addressed very effectively. We're seeing it in many schools across the country, and we're going to continue to see it more as those that are committed to doing what's right for kids actually do provide in-person learning and provide them the option of being there 5 days a week, learning, moving ahead, as they should be doing. You know, a kid's only 7 one time in their life.
Yeah.
You can't get that time back, and that's true for children of all ages.
Education Secretary Betsy DeVos, ma'am, thank you so much.
Thanks, Trace.